We know that patients will form judgments and impressions about us within the first seconds and minutes of meeting us. So it is critical that we make that first impression as good as possible to make the rest of our time with them beneficial. Welcome back to Clinical Communication. My name is Ben. I'm a specialist physio and clinical communication skills facilitator here in the UK. And today we're discussing those first impressions, first minutes we spend with the patients in front of us, and how we can maximize them and set as good an impression as possible to make the rest of our time with them effective. And we're not just discussing the tones of voice or the words we use today. This is also body language, this is demeanor, this is how you present yourself, because the patient in front of you, or even just laying eyes on you, will start subconsciously thinking, can I trust this person? Can I get on with this person? Can they help me? So the better first impression we can form, like I say, the more it's going to help the rest of that time with them. So where do we start? How do we set a great impression? Well, whether it's at an appointment and you're calling them in, or it's at a bedside and you're going towards them, first thing is names. What is their name? What do they like to be called? And use it. They may not like to be called their first name. They may like to be called a different name. The key thing is you clarify and then you use it repeatedly. Even just using someone's name shows that you're interested in them, shows that you care. No one wants to be treated by the person who just refers to them as patient X or the knee or whatever the problem is. Use that name and also explain who you are. Don't just bring them in and start going on, because there may be some uncertainty. If you want to help build trust and their belief that you can help them, you need to tell them who you are as well and what you do. They don't need your career story, but just some information so they can have an idea about what to expect for the rest of your time with them. In regards to demeanor, people often talk about a nice smile, but a smile may not always be appropriate. If you're seeing a patient for a problem, whatever it is, they may not be in their happiest mood or best time. So a kind of neutral, small smile is fine, but you don't need to go over the top, because it may not be appropriate, especially if it's going to be quite a serious situation or a breaking bad news. And people also ask about handshaking. In essence, there is no right or wrong. It depends on your personal comfort. Some people like to shake hands, others don't. It depends on where you are as well. If you're worried about infections, again, it may not be that appropriate. But if you feel it is appropriate, you can shake hands. The key thing is just be careful with how hard you shake. If you have 80-year-old Ethel with her very small, weak handshake, going in for a very firm, grasping handshake may actually hurt her hand quite a lot and not set a good impression. At the same time, if we have John, who's very big and burly and likes to give a big, firm handshake, you don't need to compete with him. Kind of meet them where they're at with their handshake, like we talk about meeting where they're at with emotions or body language. But do what you feel comfortable. You don't have to shake hands. Now, if you're at someone's bedside or you've come to them, you can start on with having a conversation. But if you're at an outpatient or community appointment, there'll normally be this walk where the waiting room to then where you're going to see them. And we do have recommendations about what not to say in that journey. So there's a nice qualitative study by Lisa Roberts and her colleagues a few years ago where they asked patients what they do or don't like being asked or discussed in that journey from the waiting area to the appointment room. And you can make the small talk about the weather or some sports, but what they didn't like is questions that will give negative answers. So the classics of how was your parking or how was your journey? Things you suspect may get a negative answer. But the big thing they didn't like being asked was the question, how are you? It's not about the words or the question. It's the timing of it. Think about it. This is a patient who's come to see you for a problem. So they're not in the best health and they're sat in this waiting area. You call them in front of everyone, ask, how are you? Are they going to say, oh, I'm not good, or I'm not great? Probably not. They don't want to lose face or embarrass you. So they may have to lie and not tell you the truth. Or the opposite happens. You call them in, you say, how are you? And they say, I'm terrible. Oh, I'm rubbish. What impression is that going to set for all the other patients about your service or you? Probably a negative one. So bring them in and wait until you are in your appointment place, be it a room or somewhere else, and then ask, how are you? Because you're more likely to A, help them save face, more likely to get the truth. And when you're collecting them from the waiting area to the appointment room, once you've clarified their name, walk with them to the room. Don't walk ahead and show them your back, because they've not been to where you work before. They don't know how it looks. Walk with them to show that you're by their side and you're going to support them. And chat as you go, but don't go ahead. Don't be that person I've seen many times who just walks on ahead and expects the patient to follow, because you're already showing that you're not interested. And once you're in, or once you've started your conversation, as I said earlier, explain who you are, give them your name, what you like to be called, and tell them who you are, what your job is. They don't need the full 10-word description of your job. Just, my name's Ben, I'm one of the physios with the team. Or, my name's John, I'm one of the doctors here. Or, my name's Chris, I'm one of the nurses here. Simple. And then after that, we'd always suggest that you tell them what you know so far. Doesn't have to be all the details, but to at least show that you've read the notes beforehand. One of the biggest patient complaints is, I went to see this person and they hadn't read my notes beforehand. They didn't care. So by showing that you are aware at least why they're there and you've got some information, you're showing that you've read those notes already. You're showing that you're interested in them and that you can help. This may be as simple as, I understand from this referral we've got here that you've got some back pain and you've had it for about 6 months now and you're not getting better with these medications. Is that correct? You might have more information than that, but simple enough, give them some information and then you can give out more as you go through your history taking. And what you can do is you're then going to what we call signpost or set the scene. So you've introduced yourself, you've clarified what you know so far, and then give them an idea of what the appointment's going to look like, or if you're going to them, what that time's going to look like. You may need to ask them some questions. You may need to do some tests and see what they can do. And then at the end, maybe have a discussion about the next steps or their options. Depends on what your role is and what you're seeing them for. But just give them an outline of what to expect. It helps the person in front of you feel calmer, less anxious, and more comfortable to then start talking to you. And once you've done that signpost or setting the scene, and if you need to get any consent or permissions for something, then do, and otherwise carry on with your subjective or history taking as you need to. But I cannot reiterate enough how those subtle things of your demeanor and those subtle words you say and just making sure someone is comfortable can really set a great impression to make the rest of that appointment and the time with you easier and more beneficial for everyone. If you found this useful, then please do share it with others. Please do contact me on the information on the screen here or in the description about any guests to get on, topics to cover, or questions you have. Thank you for watching or listening, and I'll see you next time.